joining us. Okay. For those who don't know me, my name is Shelby Rosner. I'm the president of OJNA. We're trying our best to support all of you. It's very stressful for everybody. I hope you're all members of our Facebook group. We have 300 nurses and students and NPs there. It's an extremely supportive forum right now. There's posts every minute. There's another post. Emotional, educational, resources, halacha, just a lot. So if you're not on there, please join us. I'm going to introduce Dr. Novick. She's the Dean of the Azrieli Graduate School of Jewish Education and Administration and holds the Rain and Stanley Silverstein Chair in Professional Ethics and Values. Sorry, I don't know whose screen is sharing here. In addition to her Yeshiva University appointment, Dr. Novick has since its founding...
And is sharing her screen.
Oh, okay.
There we go.
Okay. In addition to her Yeshiva University appointment, Dr. Novick has since its founding served as the co-educational director of the Hidden Sparks program, which provides consultation and professional development to day schools and yeshivas to support the success of diverse learners. Dr. Novick received her PhD in clinical psychology from Rutgers University and completed her doctoral internship at Beth Israel Medical Center in New York. She developed the Alliance for School Mental Health at North Shore Long Island Jewish Medical Center and served as its director, bringing state-of-the-art social, emotional, behavioral, and mental health prevention and services to its students. Collaborating with her Alliance staff and experienced educators, she authored the Brave Bully Prevention Program for schools. Thank you so much for joining us. We look forward to hearing your presentation.
Thank you, and thank you for having me, but more importantly, thank you for the work that you're doing, both in this group and in your positions. You really are keeping us all well at enormous sacrifice to all of you, and I'm blown away by the fact that so many of you could join here tonight. And Sheppy gave me like a really easy job to just help you with stress and anxiety, facing death, managing Pesach, and coping in the next 30 minutes or so. So I'll do what I can. But know that, the first thing that we all have to realize, and you more than anyone know this, is that we are living in abnormal, it's not the new normal, it's the new abnormal. And therefore, anything and everything you are feeling is normal. My brother reminded me that I had said to him after 9/11, that I had heard a talk from a trauma expert, and they said that every New Yorker, the week after 9/11, every single person in New York qualified for the diagnosis of post-traumatic stress disorder. The only qualification we were missing was duration, because it had only been a week. But every one of us had every other symptom. And we are not post-traumatic stress. We are in the trauma. We're not post anything. We are living it, and nurses and medical professionals are living it up close and extraordinarily personally. And that means that you have to kind of give yourself a very wide allowance for what you're experiencing and not say, oh my gosh, why am I so panicked? Or why am I so tired? Or why am I, we call it, my colleagues and I, mush brain. Why do I have mush brain? Why is it that I'm not thinking and working in the way that I typically do? Despite the fact that we are living in the midst of a crisis, we all have to manage. We have to get up every day, go to our jobs, some of us, which are much more demanding and both physically and emotionally stressful than others. So how do we do that? Well, in times of enormous crisis, what's helpful is to think about even the very small things that we can manage, that are in our control. So much now is not in our control, but there are small things that are in our control. We can take certain precautions. We can have better, the best nutrition possible given what food is available to us on shift, when we're working, etc. We can work very hard to keep our sleep as normal as possible and to do the things that will help us calm down. And I'm going to say this too when I get to talking about coping. There is no one solution to stress and to crisis and to trauma. each one of us has to find our own way. For some people, you know, music is an unbelievable release, and listening to music is extraordinarily stress reducing. For other people, journaling. For some people, it's nature, being able to look at the trees that are blooming, and my daffodils came up yesterday. You know, does that reduce your stress? For some of us, it is meditation or relaxation or breathing exercises. The problem with all of those things is that, and anyone who's tried any of them knows, you don't,
how do I check them?
I'm sorry? Oh, anyone who's tried any of those.
What do you mean check my contacts? You need the,
Okay, yeah, mute yourself. By the way, if people have questions, I have the chat room open. If you have a question while I'm talking, feel free to type it in the chat, and I will keep an eye on it so that I can answer any of your questions as I'm speaking. We each have to find what works for us. The problem with meditation, yoga, relaxation, breathing, is that much in the same way that I assume that most of you know how to drive, you did not learn how to drive in rush hour in Midtown Manhattan. You mastered that skill on a quiet back street where there wasn't a lot of challenge. So trying to learn how to be a relaxed person now is not the best way to master that skill. Learning how to meditate now when we're in the midst of trauma and crisis is difficult, but it's not impossible. Just again, have realistic expectations and don't say, oh, I put an app on my phone for mindfulness. Today, I've mastered mindfulness. It's going to take time. But I would say in your attempt to find what works for you, you have to give things a chance. And if something doesn't work on day one, you may have to make a commitment and say, I'm going to try that breathing exercise for 3 days before I decide it doesn't work for me. The final thing I want to say about stress and anxiety is that what is unbelievably potent and powerful is our brain. What we think about situations has enormous impact on every other aspect of our lives, including our physiology. Again, I'm preaching to the choir here when I tell you, although I always tell the story because when I was doing my internship in Beth Israel years ago, I don't want to admit how long ago, you'll do the math, you'll know how old I am. Let's just say I am in a risk category. I am that old. But when I was interning, one of my colleagues said, I'm leaving the field of clinical psychology to go study the relationship between stress and cancer. And I said, oh, come on. What do you mean? How could there be a relationship, this is how old I am, between stress and a physical disease? That's how, you know, and I'm really not talking that long ago, but how poor an understanding we had of the relationship between what stress does to our body. We now know that there's a direct relationship. And that means that what we think in our heads, if they are stress-producing thoughts, then we have to figure out a way to change our thinking. And through changing our thinking, we're going to decrease our stress and deal with our physiology. We're going to increase, I mean, we know, by the way, through very careful research now, that stress interferes with our immune response. We have a better chance of staying healthy if we can stay de-stressed and calmer. So how do we do that? How do we change what's in our head? I want to give you 2 suggestions or 2 guiding questions to ask yourself. When you, first of all, a passing thought in our mind is not what causes us stress. It's a thought that takes residence, that sticks in our mind, that we can't get past, that keeps playing over and over and over again on our mental playlist. Those are the thoughts that cause us stress and that contribute to physiological arousal and all of the sequelae of stress. So the 2 questions we have to ask ourselves when we find a thought running over and over, usually a worry, is question 1, is it true? Now, sometimes, I mean, all of our worries have a kernel of truth or we'd reject them. None of us, by the way, are walking around feeling stressed that aliens are taking over the planet right now. That is not the fear. That is, you know, keeping us up at night. Maybe it's a distant fear that some of you harbor, but it isn't predominant. But if you are worried right now about illness and about disease, there's a logic to that, and there's a reasonable, it's a logical fear. So we can't say, I'm getting that out of my head because it's illogical. So we have to move to the next question when we have a thought running over and over in our head, and that question is this helpful? Is giving this thought prime real estate space in my brain helping me? If it's making sure that I hand wash carefully and that I self-quarantine when I need to and that I'm careful at work with precautions, great, then hold on to that thought. But if the thought is not adding to your healthy precautionary measures and it instead is adding to your stress, then we have to work to clean up to do some mental housekeeping and clean up our thinking. And we can't do that, by the way, it's not effective to say, as our grandmothers, God bless them, and our mothers, Ad May of Esrim, they should all live and be healthy, tell us, think happy thoughts. The brain does not like a vacuum, and it will not replace something that is taking a lot of mental energy and space with something simple. We need something at least as engaging to replace it. We need thoughts that are at least as potent and powerful to replace thoughts that are causing us worry and stress. So it may not work to say, think happy thoughts, but it may work to say, when this thought comes into my head, instead, I am going to focus on my memory of the family trip last summer to that beautiful park. I'm going to use all 5 of my senses to imagine everything I can about that day. I'm going to see if I can remember the color shirt everyone was wearing. It sounds silly, but when we engage our brain with that level of remembering a pleasant memory, it can't get stuck on the negative. In the same way, we can use kind of a Socratic reasoning and arguing with our own thoughts, saying, yes, this is a dangerous time. Yes, there are real issues to worry about, but here are all the things I'm doing to be safe. And here are all the ways that I am keeping myself and my family protected. And here are the ways that the people in my life are staying safe. And all of that can help to decrease the stress level and help us move those thoughts out of their prime space. Now, I do see children listening with their parents, and that's fine. But one of the things that you've asked me to talk about is a serious adult subject, and that's facing loss and grieving. And this is a talk that you could probably give me, that depending on where you've worked as a nurse and what kinds of patients you've worked with, you probably have learned for yourself how you deal with the loss of a patient and how you deal with both your own sense of powerlessness that comes when that happens, your own sense of failure, how you deal with families' grief as they struggle through the difficult situation, and your feelings of powerlessness and futility at feeling that how can you possibly make a difference? All I can tell you is that you have to hold on to the fact that this is not your fault, that what you are doing is superhuman already. What everyone in the medical profession is doing is extraordinary, and that, as always, these are decisions that are in God's hands and not in ours. That being said, we also have to think about, how do we in these moments allow ourselves to recognize what we have accomplished and what we have done. I know that when I lost my dad, I don't think my mother and I could have managed those last weeks without the really unbelievable love and care of nurses, and the simple gestures and simple hellos made all the difference in our life. And I hope we communicated that to them. I don't know that you're hearing enough from the families, because families are not allowed to visit their sick relatives. So you're not getting those thank yous. And many of the patients at end stage can't thank you, but know that you make a difference. And, you know, take away from these terrible losses and this terrible grief that you really are doing superhuman work through this. I'm afraid to say it, but I think we have a lot coming. And I know that this week I work more in the Jewish educational community. There were 3 in one day, 3 losses that related to Jewish day schools. Not all the same school, not all the same community, but in our tight community, 3 in a day. And I know that we're not done, and there's more we're going to have to deal with. But the numbers can be quite daunting and overwhelming. But it's not new to many of you, and it's not new to many of us. And I don't have any magic other than, and I would say this when I talk about coping in a moment, but we are really, really fortunate to be people of faith, because all of the psychology, all of the research on both trauma and grieving suggests that the way out, the way to cope with this is through faith, and is through feeling that we have a purpose and that we have meaning. And I hope that every single one of you understands the meaning that you bring to people's lives, and that the work that you do really is sacred work. Okay, from the horrific to the just everyday challenging Pesach. I said to a colleague today, this is Rosh Chodesh Nisan. It is Zman Cherutenu. It is how ironic that we are celebrating the time of our freedom and liberation in our homes, unable to leave. In some ways, imprisoned. Lahavdil, we have it pretty good. I'm really not complaining about being at home. But I think that one of the things that all of us are going to have to do about Pesach on multiple levels is, first, we're going to have to lower our expectations. We are not going to have the, hand-dipped strawberries and 4 gourmet meals and 12 different courses and the Seder table all set with beautiful dishes, used paper. Toivel less. Today our shul said, don't toivel Kalim. The Kalim mikveh is closed for so that we don't spread COVID-19 germs. We are all going to have to take our Pesach craziness down more than a notch, but many, many notches, and make it okay. Make it just be okay that I'm not doing the Pesach that I normally do, or if this is the first time you're making Pesach, that you make a Pesach that is meaningful and is enjoyable, but it does not have to be elaborate. You can't get to the room fast enough because of the PPE in terms of helping patients. I totally understand, but Stephen is right. You have to be protected because, I always say this to parents, but it's really, really true for nurses and medical care professionals. There's a reason when you fly on an airplane, they make the announcement the same every single time. If the cabin loses pressure, oxygen masks will fall. Place yours first before helping others. We can't lose you guys and ladies. We need you. We need every one of you. Please God, be well and healthy. Ad mea be'esrim, because we're counting on you. So you have to take care of yourself. Just back to Pesach and expectations. The other way we have to manage our expectations is that many of us may have been so looking forward to Pesach with family, with our elderly parents getting nachas from our children, with our children being able to learn with their grandparents, with our siblings finally visiting us, with times together. And this is going to be a very small Pesach for many of us. We're going to have to find ways to rejoice in what we have. I did something today. I'll just share it with you. Maybe you want to, try it. I always, my minhag when I'm home for Pesach, I cover the glass doors of cabinets that have chametz in them. I just don't like to look at my chametz over Pesach. I know it's sold, I know it's not mine, but I like to cover it. And usually I just cover it with some wrapping paper or something. Today I printed out on my home computer pictures of all of my children and grandchildren, and my cabinet doors are covered with my family. They can't be with me, but I'm going to look at them all through Pesach. That's the way I had to lower my expectations, but still, and my husband walked in the room and he was like elated. He said, "Oh, this is so amazing." I know, by the way, a couple that once actually set their table, and when they were traveling, they were visiting from Israel. This was not virus related, but they missed their children. And so they brought pictures and they set the pictures at each place where their children would be sitting at the table. We need to think about how we make this Pesach one to remember, one for the record books, not because of the loss and not because of the grief, but because we had time with people that we love and we found ways, magical, technological ways to be together with them in ways that we would never have thought of before. Okay, coping. Really, all of this is about how do we cope. And, you know, the research on stress is that stress can have stealing effects. Sandman, I understand that some people don't like being called heroes because you're just doing your job. But I think teachers are heroes right now. I think parents are heroes. I think all of us, every human being on the planet right now is being asked. I think staying at home is heroic. It's just, you know, really thinking. To me, a hero is someone who thinks beyond themselves. And as the mother of sons, by the way, my favorite hero, my favorite day was when Cal Ripken was elected to the Baseball Hall of Fame. Now, if you're not a baseball fan, you will not know that the reason Cal Ripken made it into the Baseball Hall of Fame was not for hitting home runs. It was not for having the most steals. It was for showing up to play more consecutive days than anyone else. He never missed work. He showed up. To me, that's heroic. And you may be right, that's all you're doing is your job, and you may be right that you're terrified. I think it's not heroic to go into danger and not be terrified. It's stupid. It's smart that you're terrified. And I hope some of that terror allows you to stay safe. But it is heroic. Okay, coping. So when we deal with stress, it can steal us. There's research on paratroopers. First time they jump out of the plane, they are horrifically stressed. Their galvanic skin response goes way up. All of their autonomic responses off the charts. They're basically in a panic the first time. But what happens each time they jump out of the plane? The stress steals them. They get better able to deal with it. And over time, they're cool cucumbers jumping out of planes. Now, if you want a more normative piece of research about the stealing effects of stress, children who've had an early normative separation from their parents, you know, they went to grandma and grandpa's overnight while mom and dad went to a wedding, tolerate a hospitalization with separation much better. Again, children get steeled by that former stress experience and they're better able to deal with stress. But we know there are some people that aren't like that. Despite one stressful experience, they fall apart. What's the difference? The difference is coping. If you have coping skills in place, then stress becomes something that hardens us, that allows us to move forward. It allows us kind of like the, I don't know, is everybody here in the New York area? No, all over. Okay, so this is a good example. In the Northeast, when we have storms, trees go down because in the Northeast, trees have very solid trunks. They're not very pliable. They're thick oaks and elms and maples. And when a storm comes, they topple over or they lose a large part of their branches because they have no give. They're not flexible. But if you've ever watched storms in Florida and you watch the news, there's always a newscaster in front of palm trees and they bend almost in half. And then after the storm, they perk right back up and they stand up. And palm trees don't generally get uprooted because they have that flexibility. That's coping, that ability to be flexible, to bend rather than to break, rather than to be rigid. They're able to give. That's a coping skill. But what are some other specific coping skills I want to give you? One is gratitude. I know that it sounds absolutely absurd. And, I've been teaching this for years about gratitude journals and the power of writing down every day 3 things that you're thankful for, 3 things that went well, 3 things that made your day. The act of writing it down makes a difference. And that there's been all kinds of research that it changes physiology, it changes mood and affect, it makes us less depressed, it helps us cope with stress. And I have to say that for years, I have fought doing it. I've said, even though I teach people to do it, I don't really need to write it down. What do I need it for? You know what? A week ago, I started a gratitude journal. And I started the practice of every single day. And I have to say, I see the impact already. I see what it is like to sit down and have to reflect at the end of my day. There was that bluebird in the yard. I saw a bluebird today. Or yesterday was a really good day. My grandson was named. My grandson's bris. I wasn't there, but it's still in my gratitude journal that a new little Yidden was named and brought into the covenant yesterday. So gratitude makes a difference, and finding your own gratitude practice. And by the way, engaging your family in it as well. If you have children, it's wonderful for children. It can become a family coping structure. Thank you for the mazel tov. The second thing that is part of coping is meaning and purpose. Now, on some level, you're already doing this. You are living a life of meaning. You have a clear purpose. As I've said before, there's really no one beyond medical professionals that has a more important purpose now, other than maybe the people who are doing the research to find us a vaccine or a treatment. But I'm sorry, I'm getting pop-ups on my computer. But you may need, because it feels to you like, well, but this is just my job. You may need to define, well, through this crisis, what is my purpose? And maybe your purpose is you're going to smile at somebody, not so easy behind a mask. You're going to say hello to more people. Your purpose is to make the experience, because people are very alone in this time. Your purpose is you're going to reach out, and as difficult as it is, you're going to call people on your, with your car phone, safe driving, calling, on your way to or from your job. You're going to do something that gives you a sense of purpose. And I think that it is very, very difficult. I'm seeing a lot of posts for people who are alone. And I know that there are numerous posts on mental health discussion boards now, as well as on rabbinic discussion boards now, that say very, very clearly, if this is really a tircha for you, if this is really a sakana for you, if you really feel like, I don't know how I can do this, ask your rabbi. There are people discussing heterim and special ways to make sure that people get a visit, get connected, get someone. I mean, again, I'm seeing all kinds of ingenious ways of feeling apart and feeling connected without being within 6 feet of each other. People talking from the street to their front door. People talking in ways that are Shabbostic. On Shabbos, you can't pick up and call the phone or to Zoom someone, but somebody can say at noon, I'm going to be outside your apartment on the street, and I just want to wave to you, say hello, and see how you're doing. So we don't feel so isolated and alone, thinking about how we can help those people who are in our lives but are alone. And for those of you who are alone, how you are going to, manage through this time. And, you know, one of the greatest coping strategies we have is preparation. So don't wait until hours before Shabbos on these long Shabbosim to say, oh, what am I going to do on Shabbos? If you can order from Amazon Prime puzzles and things that are Shabbostic that you can do, make sure you have books for reading. Think about, where can I put a chair right out on my balcony or that I could sit outside and get some sunshine. We have to think about what we can do for ourselves, what we can do for others, and how we cope in these extraordinarily difficult times. I feel I'm located, I think you're talking to someone else. I feel like it's a drop in the bucket, what I'm offering you. Kol hakavod, and you should all go from strength to strength. We should, please God, meet again to talk about the wonders of healthcare and how we can make a difference in our communities and in our own lives without having to deal with coronavirus and other difficulties. And I would be absolutely happy to meet with all of you again at another time.
Thank you so much, Dr. Novick. Does anyone have one or two questions maybe for her until Dr. Glatt comes on? He'll be on in a few minutes. I guess message Dr. Novick. If you have a question, you want her to talk about something.
I see a question about managing the homework balance when you're so needed. And, you know, do you keep exposing yourself beyond contractual obligations? This is such a personal decision. You know, I know that I today was enrolled in New York State's emergency mental health provider hotline, because I felt like, listen, a hotline is not putting myself at danger at all, and it's the least I can do. But I noticed that they, at one point, they asked, you know, how many hours, how many shifts are you willing to do? We thought, you know, I don't have small children at home. I should just, and then I realized that, you know, for my sake, for those in my family sphere that need me, and for my other work, you know, responsibilities that are contractual, that I think we all have to think about, how do we set limits? Just remember again, that airplane, you are no good to anyone if you don't take care of yourself. And so don't be a stupid hero, be a smart hero, and, you know, pull back where you need to pull back. How do you transition from the unbelievable level of stress that you're dealing with at work to the mundane details at home? I'm not sure, other than sometimes we need a transition. Sometimes we need to take 3 deep breaths in the car and to say, literally, I once did this in a workshop with kids and they all copied me. I just pantomime, literally, I'm taking off my hat, my teacher hat, and I'm now going to be a 6th grader. And everybody in the room just did this. Sometimes we literally need to say, okay, I'm taking off the nurse's uniform, metaphorically and really. And now I'm going to go be mommy or daddy. And now I'm just going to go make a normal pot of spaghetti until Pesach. Matzah balls, whatever, if you non-gebrachs. I think I see that Dr. Glatt is getting ready to join, and I need to join to get on my other call. Turning off your phones does help to detach. Thank you all again so much. Achag kasher v'sameach, and may we join and see each other soon in good health and in good times.
Thank you so much. That was very helpful, as we see from the chat, and people are actually sending me private messages as well on my cell phone. I really appreciate it. Good luck on your next call. Thank you very much. We're now going to hear from Dr. Glatt. Just want everyone to know we have almost 160 people joining us, and there are plenty who are on different time zones or countries who want the recording, which I will share with them. It's really great that we can provide this chazak and information with you. Thank you, Rabbi Glatt, for joining us. I know you also have another conference call coming up. We're very, very appreciative of the time you're giving us now. Rabbi Glatt is the assistant rabbi at Young Israel of Woodmere. He has been giving a Daf Yomi shir for nearly 30 years and gives a weekly Gemara Ian shir, daily halacha shirim, and many other classes, including a daily online Dirshu Mishnah Brura Yomi shir on OU Torah. He is international lecturer on medical and halachic issues. And Rabbi Glad has authored 2 Sfarim through ArtScroll. One is Visiting the Sick, a halachic and medical guide with down-to-earth advice. And the second one is called Women in the Talmud. He is board certified in internal medicine and infectious diseases. Rabbi Glad is currently the chairman of medicine and chief of infectious disease hospital epidemiologist at South Nassau Communities Hospital. He's a full clinical professor of medicine at the Icahn School of Medicine at Mount Sinai in New York and a spokesperson for the Infectious Disease Society of America. Previously, he held positions as executive vice president at Mercy Medical Center. He was the president and CEO of St. Joseph Hospital and associate dean at New York Medical College. Thank you very, very much. We look forward to hearing your presentation.
Thank you very, very much. I hope everybody can hear me okay. This is a very important subject. The nurses are at the front line. Doctors spend a few minutes at every patient's bedside. Nurses spend the day at the patient's bedside. So I want to thank you for the wonderful work that you do. I want to thank the Orthodox Nurses Association for inviting me. And I'd like to try to give you very practical information that you can, as Hashem, use tonight if you're still working tonight or tomorrow regarding COVID-19. So very, very brief medical background. I'm assuming everybody listening on this line has already, unfortunately, had a tremendous amount of experience. If you're a practicing nurse in a hospital in our region and in many other regions, our hospitals are packed right now. We went from 2 weeks ago having 0 cases of COVID in Nassau County to now every single hospital in Nassau County having well over 100 patients of COVID. A significant percentage of our hospital is now COVID-positive patients, and they're very sick. Many of them are in the ICU. Many of them are nebuch on ventilators, and nebuch there have been deaths as well. And this is worse in other parts of the greater New York area. This is worse in Seattle. This is worse in Italy, and it's been worse in other countries in Europe and in China and in Southeast Asia. So this is a machala that we, in our careers, have never seen anything like it. And I've been through 30 plus years of infectious diseases. We've seen pretty much everything from HIV infection to all sorts of viral illnesses through Ebola, Zika. This, unfortunately, has the ability to devastate our community and the entire world in some ways more so than almost any infectious disease, going back to the Spanish flu 100 years ago, when influenza, the Spanish flu, killed between 50 and 100 million people worldwide. So this is a very, very contagious illness, and it is an illness that we all have to take very seriously, especially people who are trying to provide care for nebuch people who have COVID-19. So I'd like to talk first about overall mortality and where everybody should take a little comfort. I always like to try to be optimistic, so we can take a little comfort from the fact that the CDC just published today in the Morbidity and Mortality Weekly Report the experience with the first 4,000 plus patients in the United States between the middle of February and March 16th. And they showed in this study that there were, Baruch Hashem, a number of very positive things for younger people. The experience across the world also is the same, so this is not something unique or special for the United States. But we have basically seen that children, Baruch Hashem, don't seem to get very sick. No child under the age of 14 has died from COVID-19 worldwide. There's just a bunch of pregnancy cases that have been described, and Baruch Hashem, the babies, even if they're born with COVID, or if they get COVID early in life, they, Baruch Hashem, seem to do very well. They have a mild cold. There was a paper in JAMA, just another paper today published in JAMA, paper a month ago, paper today. Baruch Hashem, babies, young children, kids in up to the age of 20 do, Baruch Hashem, very well. In the United States, there wasn't a single child in all of these cases that were described in the United States that required going to an ICU under the age of 20. So, Baruch Hashem, one of the concerns nurses tend to be women. Probably 95% of the nurses are women. Women, Baruch Hashem, have children, and everybody is concerned, even some of us men who don't have the same maternal instincts as you women. So we're also concerned about our children. So I was always terrified as an infectious disease person, am I going to bring home some sort of an illness, Rahman al-Islam, to my wife and to my children, my grandchildren now? So Baruch Hashem, Rahman al-Islam, if you were to bring something home, you're not going to be hurting your children. The overwhelming evidence says that b'li ayin hara, nothing is going to happen to your children. They're going to be okay. Children don't get bad disease. Some of them get sick. They get a cold. Some of them get even a little bit more than a cold, but they all recover. B'li ayin hara. That should be a tremendous nechama to us, a comfort amongst a very bad situation. As you get older, Baruch Hashem, still, under the age of 55, there was very, very, very little mortality. There's morbidity. You did start having some people that needed to get hospitalized. You did have some people that needed the intensive care unit, but there were very few. You can count on one hand fatalities in the under 55 age group. So again, nurses can be any age, doctors can be any age, but just statistically speaking, a great percentage of them are under the age of 55. So from your own personal health, for your own personal nervousness, b'li ayin hara, that group of patients, if they become patients, that group of professionals, if they become patients, b'li ayin hara, they do pretty well. Unfortunately, and this has been the experience in China where we have the most data from, Nebuch, this is the experience in Italy where there's horrific disease. This was the experience in Seattle where they had nursing home patients and the mortality goes up dramatically. So as you go each decade, probably above 50 to 60 to 70 to 80, and then Baruch Hashem, you're zocha to live into your 90s and your hundreds, so then mortality with COVID-19 does go up. It may be a function of your lungs just not working as well. It may be a function that you're no longer able to tolerate when you have a compromised lung, the additional compromise that COVID-19 brings to you, and your underlying lung disease. If you've been a smoker, and that's why this disease may seem to have a predominance for men. I'm guessing, I don't have data on this, but I would postulate that because in the 70 and 80-year-old population, it wasn't as frequent that women would smoke in those days. It wasn't considered proper for a woman to smoke, and it never was proper for a man to smoke, but they unfortunately thought that it was proper. And many men have underlying lung disease more so than women from smoking. And the smog in China was especially bad as well, and that's like everybody smoking, and therefore those people seem to have a worse outcome. Most of the patients who, Rahman al-Islam, do succumb to COVID-19 have some underlying illness. At the same time, it can attack anybody. And what I said about the mortality should not make people think that the teenagers, the adolescents, the young 20s and 30 people can walk around with impunity. Because A, some of them do get sick. Baruch Hashem, not that many, but some of them do get sick, especially when you get into the 30s and 40s. We have some 40-year-old people in our ICU right now on ventilators, very sick. But the real concern for them is that they're a great vector to spread disease to other people. And this is critically important. The main message that you should be giving out, that you should be carrying out, both when you're getting a few minutes of precious break time, is not to sit around with your masks off and schmooze like you normally would in a very compact and crowded nurse's locker room or nurse's lounge. You know, most of the nurses' lounges are a little circular table that normally seats 2 or 3 people, and you have 7 nurses crowded around it, all schmoozing and excited. They finally have a 2 minutes to relax and decompress. That's horrible nowadays. That was wonderful 2 months ago. But when you have people with their masks off, who some of them are at higher risk and some of them may be infected without even realizing it, you can transmit COVID when you're asymptomatic. Probably 10 to 15, maybe even 20% of the transmission is when people are asymptomatic. A bunch of those people become symptomatic, a percentage don't. So therefore, when we're sitting around in any social gathering, it's extremely dangerous because if you're in an area where there are symptomatic cases, so you're also in an area where there's a lot of asymptomatic cases. And therefore, Rabbanim, Gedolim, have closed the shuls, have closed the yeshivas, have closed Pesach, have basically closed everything down because of this pikuach nefashos. And each of us has to take this into consideration in how we conduct our lives. not only in the hospital when we're wearing full protective personal equipment. You have your face shield, you have your N95 if it's appropriate, or surgical mask, you're wearing a gown, you have gloves, the whole kit and caboodle. That's not when you're only at risk. If you don't know how to don and doff properly, that's a concern. Every one of you should be trained, and if you don't feel comfortable, you should have a partner watch you until you do feel comfortable. And even then, it might be kedai to have a partner watch you don and doff so you don't contaminate yourself. But you're also at risk in almost every other social setting. At the Kiddush on Shabbos, at the Vort, at the beautiful Chasana, Rahman al-Islam, at a Shiva call. These were unfortunately tremendously great opportunities to transmit this, which is why the Gedolei Harabanim have cut all of that out. There are no more social events right now. People will prepare for their bar mitzvahs, for their weddings. We'll let a wedding go on with b'tzimtzum, a minyan of 10, but every other event we're saying don't have it go on. The only things in religious life that we're still doing is bris milah in a very small group. I recommend that it only be the mild, the sandik in the immediate family, and the baby. The baby's important to have there as well. But that's it. No grandparents. Don't invite anybody that's not living in that family. And we also allow women to go to the mikveh. We don't allow men to go to the mikveh. But there's some beautiful guidelines that have been put out. If a mikveh is taken care of properly, which Kenai Har Baruch Shem, most of the mikvahs are, and we do things with seichel in terms of not having mingling in a common room, and we also make sure that the rooms are cleaned properly, the mikveh is chlorinated, the waters are changed on a regular basis, and women do their preparations at home and then go to the mikveh, undress, tovel, get dressed, and leave without touching everything, without using everything. And the mikveh lady stands 6 feet away, with or without a mask. That's a very safe procedure, and we want to reassure the women of the community that that is still halachically allowable and medically sanctioned as well. But all other life cycle events we put on hold. Nebuch, people are sitting shiva alone by themselves. This is to make sure that we don't spread this horrific disease. And it's critically important. This social distancing can't just be shul and Torah events. It must be the supermarket. It must be the gym. It must be shopping. Nobody's going to get new clothing for Pesach unless you order it online or you got it beforehand. You're not going to take a haircut before Pesach. You're not going to do all the things that we normally would do before Pesach. And the most tragic, and this is the one that's most painful, is you're not going to go be visiting your relatives in another household for Pesach, especially if it's in a different community, because of the risk that you're going to bring, or they're going to bring, Rahman al-Islam, COVID into the house. And especially if you're dealing with parents, grandparents, great-grandparents. So they're at greater risk. And people may be asymptomatic and not realize it. People may be mildly symptomatic. Say, I just have a cold. You know how many people have told me in the last 2 months, I just have a cold. And they could have infected an entire shul, an entire wedding. And we never have been seeing the consequences of that. So my optimal suggestion in terms of Pesach, in terms of gatherings, is wherever possible, each family unit that's together now should stay by themselves and not mix with other families. Where that is impossible, especially when you're dealing with a single elderly parent who cannot make Pesach on their own. So then the only way that you should get together with them is if everybody has been self-quarantined, really self-isolating for the 2 weeks before Pesach or the 2 weeks before you're going to get together. And then you only mix with that one person or that one couple or that one family that can't make Pesach on their own for whatever the reason. And where everybody on both sides is healthy and nobody has symptoms, nobody has a cough, nobody has a fever. Then in that situation, in a situation where you really can't afford not to be together because the older parent may not be able to take care of themselves, they can't have a Seder, they're alone, they can't be by themselves for 3-day Yontif. That's also a very, very great tragedy. Or if somebody can't make Pesach, they physically can't make Pesach. In all of these situations. So then, as long as everybody's healthy, and as long as they're self-isolating for that 2-week period of time, at least before Pesach, so then mixing like that with one mix, not I'll eat the first Seder by my parents, second Seder, Baruch Hashem, they live nearby by my in-laws, and my brother will have Shabbos meals by him, that's a disaster. And while every other year that's the most delightful part of Pesach, this year that could, Rahman al-Islan, lead to a makas bechoros that we've never had before. And that could lead to a horrible machala. So we're recommending that people who can stay by themselves, stay by themselves. And only in situations, we don't want singles to be alone. There are ways that people who are single, whether they're young or they're old, can enjoy Yontif as well, but maybe they won't enjoy it with 35 family members. Maybe they'll have to pick one family member, one family to go to. Maybe they'll pick one friend. Two singles can get together and make their own Pesach. Not ideal, but at least they won't be alone. But the mixing, going this night and that night and that night and this day with different families is a disaster. And people say, oh, we'll sit 6 feet apart. Nobody's sitting 6 feet apart. And the people that say they're sitting 6 feet apart will be on each other's laps before the end of the meal. And you're cleaning the table and you're washing the dishes and you're schmoozing, and it's a disaster. So people have to be very, very much aware that you can't do what you've done every year, as horrible as that sounds. But at the same time, we must make sure that people that are either, for Rahman al-Islam, depressed and suicidal, that we don't let them be alone for 3 days. We have to figure out methods to check on them. We have to make sure that they're not alone if it's dangerous. There are rabbanim that needs to be talked with in terms of what type of even technology can be used when there's a real safek pikuach nefashos, if somebody is all alone by themselves, because they literally, if they were to catch COVID, it would be a death sentence. You have some very sick 95-year-olds with all sorts of medications and all sorts of immunocompromise that they really shouldn't be around anybody unless they're living with that person for the last 3-4 weeks, because whatever they have, and they can't be with anybody else. So in that situations, we have to figure out what halachically is allowed to be done to make sure that they're not alone and isolated. But this Pesach, I say, Manish Tana HaPesach Hazeh Mikol HaPesachim. Why is this Pesach going to be different than every Pesach? Because every Pesach, the greatness of Pesach is that we get together with our families. And this year, the greatness of Pesach will be that we don't get together with our families, except the family that you're living with. And the family that you're living with, or that one family or one person coming to join, so they'll have a wonderful Pesach together. We should all be zochet to have a wonderful Pesach together. There are a number of other questions I was asked to specifically address. I just want to make sure I have them. Antiviral therapy. So I wish I had more definitive data for you. There are a number of both FDA approved but not proven for COVID therapies, specifically one that's being touted without a lot of data to support it, but at least with some slight data to support it, is a combination of hydroxychloroquine, which is known as Plaquenil, which is a drug used for malaria, and with or without azithromycin, a very well-known antibiotic used for various types of atypical community-acquired pneumonia. And there is some slight evidence to suggest that this may be beneficial in reducing viral load in patients with COVID-19. And there are studies underway looking at this right now. And that's an option that we would consider in patients who are admitted to the hospital, or older patients or immunocompromised patients that your Baruch Hashem don't have to admit to the hospital, but you hopefully can prevent them from coming into the hospital. In terms of experimental therapies, there are a number of drugs. There are various trials on certain antiviral agents that have been used for HIV, that have been tried to be used for Ebola. There are some interleukin agents, antagonists, IL-6. There are a number of other therapies that are being tried. Bottom line is, there is no definitive therapy today. What about vaccination? So there are amazing, amazing leaps in technology that we've had, that we're talking about actually looking at some vaccines probably in 2020, and maybe actually having them up and running and out there for the public in 2021. But I doubt that we're going to have a vaccine end this problem right now. Yezus Hashem, there is some data to suggest that maybe with the coming of summer, things will get better just from the warmer weather. Or some data to suggest that, certainly nothing definitive. But the best way to get this curve to be flattened, as everybody likes to say, is to social distance. And I can't stress that enough. I'm amazed to see videos today of shuls davening in New York. These are people, my Rebbe used to say, the Satan comes dressed sometimes in a beard and payas. the Sutton looks, how can you not go to Minyan? How can you not daven a Minyan? No, the government wants to shut down the shuls like they've been doing for the last 2,000 years. Daven in a basement, a crowded basement, where you can get away with it because there's no police, they don't see you, the windows all closed, in a small crowded basement. That's how we'll be Makayim, the Torah HaKadosha. And that's called the Sutton coming at you, the Yetzer Hara coming at you with a beard and payas, because that is a violation of numerous Isurim D'Rabbanan D'Oraisa, the least of which is that you're not listening to every Gadol B'Yisrael telling us that that's usher to do right now. As painful as it is for me to ever have recommended that you shouldn't go to a yeshiva, you shouldn't go to a shul to daven, you shouldn't go to visit your parents and grandparents for Pesach. It's the din, it's the halacha. It's not a choice. You don't have a choice. If you want to blow shofar on Rosh Hashanah if it's on Shabbos, well, we like to do blowing shofar, so we'll blow a shofar on Rosh Hashanah Shabbos. The rabbi said you're not allowed to. Does anybody have a Yetzer Hara to blow the shofar on Shabbos? No. The rabbi said you're not allowed to. The rabbis from the Aguda, the RCA, the Igud, Eretz Yisrael, all the rabbanim, the Gedolei Yisrael, the Moetzes HaGedola, the Rosh Yeshiva at YU, at Lakewood, and every yeshiva have said you're not allowed to do that. So how does anybody go today? There was a minyan going on in a crowded shtibel in an unnamed place in Brooklyn. I don't get it. And we as all healthcare professionals have to protest when we see this done. We can't look the other way because A, it's wrong, even if it's not your nefesh that's involved. You can't stand idly by. You can't watch somebody die. If you know CPR, you have to go help them. Well, samado dam riyecha. But here it's not even their dam riyecha, it's our dam riyecha, because they're going to get infected. I know Nebuch Gedolei Rabbanim that are now in ICUs. Hashem Yishmareim. They should have a refuah shleima who are in shuls and caught their disease, their potentially Rahman al-Islam fatal disease in shul at a simcha in a base medrash. And how can people still do that today? You can learn at home. You can daven with more kavanah sometimes at home. We have to get that message out. If you see people doing things like this, they'll respect you as a nurse. They'll respect you as a healthcare professional. When you tell them this is dangerous, ask the Gedolim what you should do. This is unbelievable to me that people are still doing this. I was asked to talk as well about babysitters, housekeepers. This is a very difficult problem. The easy answer is always to say, do nothing. Don't have anybody else come into your house. Well, I don't know about you. I wouldn't let any of my children, some of who are 30 or 40 years old, be alone by themselves. Children need supervision sometimes. You have to go and supervise your little kids. I'm joking about the 30 and 40-year-old kids, but we're not joking about a 2-year-old. You can't leave a 2-year-old for 10 seconds without watching what they're doing. So you need to have somebody take care of the children. You have to be at work. The husband may have to be at work. So it's great, Baruch Hashem. Now, if the nurse wife, nurse husband has to go into the hospital, maybe the spouse can take care of the children if they're not working in their office. They're not working at all, Nebuch. But if you don't have a choice and you have to have somebody come in, so then you have to have certain conditions set that they must be absolutely healthy. They can't have a fever. They can't have a cough. And you may have to make other arrangements. We have to be very careful with cleaning ladies coming into our house. We have to be very careful with any unnecessary contact. Everybody has to define what is absolutely necessary. If, Rahman al-San, you're a single parent and you have children and you have to be a nurse in the hospital, that's your parnasa, that's your responsibility. You can't ignore that. So then, yes, somebody has to take care of the children. And maybe it's a parent. Maybe it's a relative. Maybe it's a person who's been a babysitter for you. And if there's no alternative, you just have to try to make sure that everybody's as healthy as possible and figure out alternatives if Rahman al-Islam, somebody is not healthy, because this could be very dangerous. The last thing I'm going to talk about is PPE. There is a great concern in the country. Will we have enough personal protective equipment, PPE, for everybody to use? So I know a tremendous amount of time and effort is spent by the hospitals, by the hospital organizations, by the government state, local, federal, to try to guarantee and make sure that we do have enough PPE. But everybody is assuming that we may not. So everybody is doing all sorts of things which we wouldn't do in the best of all worlds. It's very easy in the past for me to put an N95 on and go into a room of a patient with tuberculosis, go out of the room, take the mask off, toss it in the garbage, and not think twice about it. That's a couple of bucks, $2, $1, whatever it is. You don't think twice about it. Today, we can't have that same cavalier attitude. It's just $1. First of all, we'll run out of them. It's not a question of the money. We can't just toss them away and use 10 of them in one day, seeing 10 different patients. So we have made decisions in our hospital, and I know many other hospitals have made the same decisions, that we need to, in these situations, figure out what's safe and yet will conserve using masks again, sterilizing them if possible. We just started in my hospital today a process where we're shipping out all our N95s to be sterilized. That's an eitzah, something we've never done before. We reuse them. We allow people to put their N95 after they doff it, take it off properly into a brown bag and reuse it the next day. Certainly reuse it that day. We recommend that people wear their masks all day long if we have a COVID unit. So we tell people to leave their PPE on all day long and just switch gloves when you go from patient to patient, but assume the whole unit is essentially a COVID zone. And in this way, you're not constantly switching your gowns, not constantly switching your face shield unless it gets visibly dirty. And in this way, we're trying to preserve the precious PPE that we have, and other hospitals have the same issues and are coming to the same conclusions. So I hope this has been somewhat helpful. I hope this has been somewhat informative. I didn't talk about a lot of other halachic areas dealing with COVID. I have given a number of shiurim online. I can circulate them with Ms. Rosner, and people can see if they want additional information on many of the other halachic aspects of COVID, as well as some of the yontif-related aspects of COVID, how you do mechiras chametz, how you do tfilas kelim, how you do levayis rachmana litzlan. I spoke a little bit about the mikvah. There's a lot more detail, and I'll try to circulate her a shiur that I gave, a 40-minute shiur on this this past Monday night. I'm losing track of the days. Today's is Wednesday night, correct? No, today's Thursday. It's a blend. It's one blend. The only time I'm off is Baruch Hashem Shabbos. And I gave a shiur on Monday night, which I think is still probably 98% correct. If it was correct then, there's things that always change. So I'll try to circulate that as well if people are interested in more details. But I just want to give you a bracha and tell you that you're doing HaKadosh Baruch Hu's work. And what we say, Shluchei mitzvah ein nizakin, so that's true, but not if it's something called shchicha hazeka. If you're protected when you do Hashem's work, but only if you're not taking chances. So Be'ezras Hashem, if you do properly put on your PPE and you take it very seriously, and you try to socially distance to the maximum, and you encourage everybody else to do the same, Be'ezras Hashem, we should all be healthy, stay healthy. For those of you that Rahman al-Litzlan have already been sick with COVID, hopefully you've recovered. Maybe you'll be a resource. We're starting a trial at our hospital, and many other hospitals are looking at this as well. The convalescent serum of patients who have had COVID, maybe that can be used to make like a hypogamma globulin that could be used to treat patients. So there's studies that are looking at this right now, some preliminary data from China that says that may be effective. Be'ezras Hashem, if we do what we're supposed to do, if we increase all of the chesed that we normally do at this time of the year, and we go and make sure that we don't leave people isolated as they're physically isolated, we make sure that they're not mentally and depressed isolated. And if we make sure that we prepare for Pesach in the best way that we possibly can, knowing it will be different, but knowing there will be a chak kosher v'sameach. When Hashem sees us trying to pass this nisayon, this difficult test with flying colors, so Mirz Hashem, He will say, I don't need to give you this nisayon anymore. You've passed this test, and I can allow you all to be healthy and safe and have a chag kosher v'sameach. Thank you very, very much for listening. Mirz Hashem, we should all be zocha to all good things and bracha. Thank you.
Amen. Thank you so much for your time. I know it's so tight. We all gained a lot. There were a lot of questions coming through the chat. So if all of you could maybe send me your questions to info@jewishnurses.org. I'm going to arrange another conference call next week so we can address, there were a lot of questions coming in.
Okay, I'll be happy to try to help that. I'm going on now to another call. This is really for singles, shidduchim issues and how to date. It's put on by YU Connects. If you're interested, it's going to start at 9 o'clock.
Can you share the Zoom?
I will send that to you right now.
Can you send it on the chat so whoever wants to join in?
I will try to do
Chat
that.
at the bottom.
If you want to hold on, let me see.
There's a chat box flashing at the bottom.
No, I know how to do it. I just have to find the link for it. So hold on a second.
So if anyone wants to join, you can join there. And I'm going to try to arrange another call next week because to address many questions, and I'm sure more things will come up in the next few days. And again, for those of you who were in here in the beginning of the call, I hope you're all with us on Facebook. There's a tremendous amount of resources, education, chizuk, stress relief, good and bad going on over there. So please join us, 3,000 nurses and students and NPs, and get some strength there. I hope you all enjoyed and gained some information tonight.
I'm putting it on in a second, so.
Someone asked where on Facebook. We have a Facebook group called Orthodox Jewish Nurses Association. It's a private group. You're going to have screening questions. If you don't answer them, we will not allow you in. The board members, and we have some moderators taking care of that group. So make sure you answer the questions.
Okay.
The email address is info@jewishnurses.org. Everyone send your questions, and I'll try to incorporate them with the speakers next week.
Okay, and I think I just put it on correctly. You let me know if you see it. I think I did it for everyone. So for those, it's going to start at 9 o'clock. Harav Willik Shlita will be speaking. I'll be speaking briefly, and some other speakers as well. About a half an hour, 40-minute program, specifically dealing with dating issues in this era of COVID. It's put on by YU Connects.
Can I ask a question, a short question?
Sure.
Do you feel that all of us healthcare providers should be wearing masks now on the outside work?
So I don't wear a mask myself outside. I don't think that that's something that you should do. If you're going into a crowded area and you don't have a choice, it's not unreasonable to wear a mask. We recommend that everybody wear a mask all the time in the hospital except when you're eating. And we recommend that you eat by yourself and not eat in the typical way that people in the hospital like to eat on top of each other. So when you have to take off your mask in the hospital, we recommend that you socially distance as possible. And we do recommend, we made this recommendation about 2 weeks ago, that people wear masks at all time in the hospital, just because the risk is so great. And if you're going out to the supermarket and you have a mask and you wear it, I wouldn't say that that's wrong, but you're walking in the street. I love to take a walk with my wife to get outside. I recommend people do get outside, so I don't wear a mask when I'm walking with my wife.
Okay. Thank you again. Have a good night, everyone.
Thank you.